Hello everybody, I am Roberto Ferrari from the University of Ferrara, and I'm here to tell you that to have elevated blood pressure is bad. It damages the heart, the brain and the kidney. And the problem is that you do not feel the level of pressure in the pipes of your body. For this reason, hypertension or high blood pressure is considered the silent killer. This is because there is too much salt in your meal. So please, my message to you is please reduce the salt in your meal. Cook with less salt. Remember, this is an S.O.S. Step down with your salt. It's very important for your health. Of course, this can be done, and Dr. Ramandeep Singh Ahuja will tell you how to do it.
Thanks to Dr. Roberto Ferrari for giving us valuable insight on the effect of salt in hypertension and making us aware of the new concept of step down. As far as salt intake is concerned, I think we all are very well aware that the salt intake should be curtailed to a minimum. The average salt intake for an Indian patient is 11 grams, which is a staggering number because the recommended amount by WHO is actually 5 grams in a day. Decreasing the salt intake is quite effective in controlling the blood pressure, and therefore the salt intake has to be stepped down. There are ways in which we can go about to decrease the salt intake. One of the ways is to decrease the intake of salt, to decrease the usage of salt in foods. So whenever we are making anything for ourselves in the form of parathas or puris, salt should not be added to the dough of that material. Extra salt should not be sprinkled on food, and we should always avoid table salt. This way we'll be able to decrease the salt intake, and also we'll be able to decrease the blood pressure quite well. What generally we tell our patients is to take 1 teaspoon of salt every day in the morning, keep it separately, and throughout the day use the salt from that amount that we've kept separated for ourselves. What we always tell our patients, take 5 grams, keep it separately, and throughout the day use salt from that amount. This way we'll be able to decrease the salt intake, and we'll be able to control our BP much better.